Yes, please come.
Good afternoon, sir. Good afternoon, sir. Good afternoon.
Take a seat.
Thank you, sir.
So, Manu, you have a very impressive bio, and hopefully you will do very well in life. What is the reason why you are keen to join the civil services?
Yeah, I think civil services will give me a broad and a diverse platform and to make a greater impact in most direct ways.
Any particular field of endeavor that you feel will be more close to your heart if you become a civil servant?
So being a doctor, health would be closer to my heart, but I would like to work in fields of education and other fields, education and tourism also.
So education and healthcare you have touched upon, these are the basic foundations of any country and any society.
Yes.
What is the percentage of GDP that India is spending on education and healthcare? And what broadly is lacking in education and healthcare? Very briefly.
Sir, with regard to health sector, so the total spending that is being done is 3.3% of the GDP, but out of that, 2.2% is being 2.2% of the GDP is what the government is making. The rest is by the private sector. And so, I'm sorry, but I'm not recalling the percentage of investment which is done on the education sector.
Okay, but what are the gaps in both sectors broadly?
So in health sector, we are lacking on the preventive aspect as of what's the first point. So we have more focus towards the treatment part than focusing on the prevention. So second, infrastructure, health infrastructure is lacking, especially in the rural areas. So third, in the medical education also, there's lesser focus on the other traditional systems of medicines like the Ayush system. And so fourth, I think a collaboration between the modern medicine and the traditional is lacking. So,
what is the shortage of doctors and medical professionals roughly in the country?
so what the WHO recommends is one doctor per 1,000 patients. And now, if we talk about a combined percentage of the Ayush doctors and the modern medicine doctors, so it is 1:834, which is, we are now meeting the requirement of doctors.
Okay. And education? Education. What are the drawbacks? What are the drawbacks currently in India?
So the ACER report on which recently came out, so it pointed that there's a lack of foundational literacy in the students, which is close to 25%, which is a huge percentage, sir. Second, I think the education sector. So can I take one?
Yeah.
So then there's inequity in the access to education, especially in the tribal areas. And third, sir, there's lesser focus towards the higher education, which is now increasing with, the government is now focusing on the higher education as well. And so third, I think more emphasis needs to be given towards participation of women in the STEM sector, which is the science and technology sector. So with regard to this.
What about pedagogical changes? The way and manner in which education is imparted, the syllabus, the teaching methodologies, any changes that have come about in the recent past, and what do you suggest?
So, I think it's been traditionally also, it's been more of a one-way kind of education imparting and less of feedback from the students, and also the students fear to ask doubts to their teachers. This is one thing. And so, second is, we are now the focus is also shifting towards imparting the education in a digital way, which can through digital boards and smart boards, which help the students to understand better.
Yeah, okay. Okay, I have a statement that women can be empowered through sports. Women can be empowered through sports. What do you have to say on this?
So I think you rightly said that women can be empowered through sports, and sports is a sector which sports not only gives physical strength but also a mental and a emotional strength to a woman, and in fact any person, not only the women. But and so we have examples from Haryana like Sakshi Malik and Manu Bhakar, who are excelling in sports, and I think it's a great tool.
Do you think economic upliftment can also take place through sports?
Yes, sir. First thing, the government is awarding the title holders in the sports. And so second, they're offering jobs to the sports person. And third, they can also open their their academies to train other sports personnel.
Does India have National Sports Day? When is it? What date?
So yeah, so we do have, but I'm not recalling the dates.
In whose memory? On whose birthday?
I'm not aware, but I'll read about it.
All right. Good.
Good afternoon, Manu. How are
Good
you?
afternoon, sir. So,
You must have had a very good rank in NEET. That is why you done your graduation from GMCH. What was your rank in NEET?
sir, I was having 2100 rank all India and 18th rank in Chandigarh.
Great. That is why you got the seat in GMCH. Very good. Now your reply to the question, why do you want to become a civil servant, is not very convincing. We need good doctors in India.
Yes, sir.
And there is a shortage of doctors, though you give the figures. That is all right. But we need good doctors like you. I suppose more convincing the reply would be, now that I have time, I'll tell her that also.
Yes, sir.
You see, you should be telling us that since India is on the cusp of becoming a developed nation from a developing nation, and you want to become a part of that story, that journey of India becoming a great country, next 5-10 years are going to be very important for India. So these 5-10 years, you want to become a part of that story of India becoming a developed nation. That is why you want to join the civil service. So that would be more convincing enough. You are from Manimajra.
Yes, sir.
Manimajra has a great history, lot of historical buildings,
Yes.
number of things. Can you tell me something about that?
Sir, there's a fort at Manimajra. It's
Yes.
the center. And sir, it's also said that there's a underground tunnel connecting the Mansa Devi temple to the Manimajra fort also. And so even the Patiala Mandir at the Mansa Devi complex was made by the Maharaja of Manimajra.
Okay. IMF has projected a very impressive GDP for India, 7.3%, right? And our finance minister also said by 28 we will be the 5 trillion economy, right? But 80 crore Indians have to be given subsidized food. And in Haryana, where we are sitting now, there are so many people lined up to go to Israel to find jobs.
Yes.
What kind of inequality of wealth distribution is this? What is the problem and what can be done about it?
So you rightly pointed out that there's inequality with respect to the income. So this also spans across so there's inequality in the rural India and the urban India, and there's inequality between the men and the women with respect to the income levels only.
So what is the
likely-
reason? What will you do if you have an opportunity to do something about it? What will you do?
So I think better implementation of the schemes which the government is running, and in longer term it will help benefit the economy, and these fruits of the benefit of economy will be divided in all sections of society, and through the better implementation of various schemes like, so we have the NFSA Act for which, so you mentioned for the distribution of food. It will help in affordable, in providing food at an affordable cost to all individuals, and so that their health and nutrition levels would improve and they will be able to contribute to the economy in a better way.
Okay, well, please tell me, MTP Act, you are aware of MTP Act?
Yes, sir.
Has been in the news. Honorable Supreme Court also has had some observations. What is it? What is the issue? And why it is being discussed?
So MTP Act is stands for the medical termination of pregnancy. So sir, in this, it gives the cutoff of the time up till which medical termination of the pregnancy can be done in a legal way. So sir, there have been discussions as to what time should be kept for which it can be said to be safe for the mother, as well as the fetus is also not having any problem till then. And sir, so the second issue is with respect to the illegal abortions having in the country.
No, fetus has a right or not? Fetus, right of the fetus versus a woman's autonomy over her body.
Yes, sir.
If these two issues are to be weighed,
Yes, sir.
what is the best thing?
So, it is said that the fetus viability is attained after 28 weeks. So, after that, there are certain complications also if we terminate the pregnancy. So, sir, that's why a balance had been achieved, and 24 weeks has been set as the limit up till which medical termination of the pregnancy can be done. So, up till 20 weeks it can be done even by a single doctor. Then in 20 to 24 weeks it requires a panel, and after that Supreme Court Supreme Court orders, it can be done after discussion with the panel, sir, weighing both the pros and cons.
What is the age of consent and what is it today, and should it be reduced? What is your view about it?
So it is currently 18 years,
Yes.
and since this is considered to be the age of majority for most of the things like driving license and voter card. So I think, sir, it should stay at 18 years.
All right. Now, Israel, have you read today's newspaper?
Yes.
Israel has offered 2 months truce for hostage exchange.
So sorry, sir.
Israel
Yes, sir.
has offered 2 months truce for exchange of hostages.
Ceasefire.
Today.
Yes.
Truce is ceasefire for 2 months so that the hostages can be exchanged.
Yes, sir.
Now, what is the reason behind it, and why Israel does not accept the two-state theory?
Sir, for the first thing, sir, why they've agreed for the ceasefire or the truce period, sir. Sir, there was also so recently the Israeli Prime Minister had refused to go for a truce period. But sir, in view of the international pressure, especially from the United States and the United Kingdom, I was not aware that he agreed for the truce period, but I think it is under international pressure that he's done so. And sir, second, he does not agree to these two-state theory because they consider it against the sovereignty, sir. Their sovereignty.
Is it some personal problems of Netanyahu at home? Is it because of that he doesn't accept the two-state?
No, sir, I don't think so, but it is a complex situation which involves various historical factors as well. Sir.
All right, my last question. The Red Sea, Houthis are attacking that,
Yes, sir.
and there are 2 routes. Can you tell me what are those 2 routes, and what is the difference in distance and time, and how will it impact India?
So the first route is, as you mentioned, through the Red Sea and passing through the Suez Canal, that we can reach, that any shipment reaches the Europe or the United States. And the other is round way through the across Africa. So
Cape of Good Hope.
through the yes, sir.
And that is how longer, how many days extra,
Sorry.
and how will it impact us?
So the time of the shipments in reaching will definitely increase. I'm not aware of the exact time that it takes. Sorry.
Thank you.
So you might have heard that the age we are thinking to reduce the age to contest the elections for Lok Sabha and state legislative assemblies from 25 years to 18 years. So we are thinking. So what are the pros and cons?
So I think the pro is that we should keep only one age for majority. That is, so as I mentioned, it is the same age for majority in cases of a person has a voting rights. So if a person has a right to vote, so why cannot he contest elections? So this is one of the pro. So so I cannot recall other points.
Okay.
And sir, with respect to the cons, sir, one can say it is such, but it can be said that at that time so much political exposure is not there to the kids, as they are just out of their higher education and they just entered. So sorry, they're just out of school and not entered the higher education where they might get some exposure of the politics.
So as you are from medical field, right?
Yes, sir.
So what's your take on health versus wealth?
So I think both of them are necessary. Wealth up to an extent is important, but I think more over that, health is more important.
So what's your take if you have to take one, wealth or health?
So I would choose health.
Okay. So you might have read today's newspaper.
Yes, sir.
So today our government have almost said that yes, we are going to give Bharat Ratna.
Yes, sir.
So to whom we are giving Bharat Ratna?
So by giving it to Mr. Karpuri Thakur, who is the ex-CM of Bihar, sir.
And who was the first to receive Bharat Ratna?
So I think he was C. Rajgopalachari ji.
So today, what is the date today?
So it's Wednesday.
Date.
Sorry, sir, I heard date. Sir, it's 24th January.
Can you relate this day to Constitution? Or anything we adopted?
So the Constitution was adopted on 26th January. So I think the major chunk of the work was being done on these 2 days.
And
Last minute work.
okay. So the election of Prime Minister, is it direct or indirect?
Sir, the Prime Minister?
Election of Prime Minister, is it direct or indirect?
Sir, it is direct election.
It is direct election.
Yes.
Are you sure?
How is it direct? Prime Minister's election?
Sir, we don't elect the Prime Minister per se as such. We elect the members of the Parliament, mainly the Lok Sabha members, who we select, and they decide on who
So how
will
does it
be
become
the.
direct?
So it becomes indirect.
Okay, sir.
Right.
Sorry.
So my last question is, you might have seen that weather is not that much good, right?
Yes, sir.
So even the rain is not there. So what is the probable reason why this kind of thing is there?
So firstly, the western disturbances which bring the rains from the Mediterranean region, so they are weaker this time. So also we saw that there is absence of snowfall in the Gulmarg region, and this is one of the reasons why, this is the main reason why rains are not happening in the northwestern India. So second, because of the effects of El Nino, which are cyclical. So because of the El Nino here this time. And the third reason which has been suggested is presence of a jet stream over the northwestern India. So that is bringing the cold air into the area.
Okay, Manu, have you read Manu Samriti? If you yes, what is the key learning you have imbibed?
Sir, I have not read Manu Smriti, but I've read about it. Sir, it was the first law book, and sir, I think this is the main crux of it, sir. So because lawfulness is very important for any society to be in harmony. So I think it is.
Can you differentiate ethics and morality?
Yes, sir. So ethics are the morals of the society, while morals pertain to one person and their intrinsic.
Okay, and recently we have changed the oath from Hippocrates to Indian person. Can you name the ancient medical practitioner after which we have revised the oath?
Sir, Socrates.
Some Indian Ayurvedic person related to some medicine. Because there was a lot of hue and cry and why are we changing from Hippocrates oath? Someone from ancient India. He did immense work in metabolism, immunity, internal medicine. Because one was surgeon, one was from medicine. Can you now?
Sir, I'm sorry, I said Socrates. It's Sushmit, sir. Sushmit.
Sushruti surgeon. Chair. Currently the
Chair.
oath has been
Chair.
issued. Have been renewed. Okay. So do you approve of the changes?
Sir, I think the basic elements of the oath remain the same, whether it's Hippocratic oath or Sushrut
Or
oath, Energy's oath, so, which is serving the society and the humanity. And so I think mere change of the name does not impact the essence of it.
So you just mentioned about Ayush as well. So what does S word in Ayush stand for?
So it stands for Siddha, which is a system of the Siddh or the known sages from the South
And
India.
this, there was current affair of Deshali. There's another ancient Tibetan medical system also considered as part of S. Can you name the Tibetan medical system?
So it's the Sovarika.
So, okay. And suppose you are in charge of health department and some new wave of COVID has outbreak. And there are 4 patients. One is health minister of the state. One is a doctor who has been practicing with you. The third is a child who is just 12 years old, and one is a 70-year person with diabetes. You have one ventilator. Which life would you choose and why?
So firstly, I would, so with respect to the severity, I think the patient who is more severe should get the ventilator. And I think, so the child with 12 year, I would like to assess the child with 12 year and the person who is 70-year-old with diabetic. Out of those who would be more severe, I would.
So you make to either in a child or a 70-year-old.
Yes, sir. I take the decision based on the severity of the case and so.
And JN1 is in use. What exactly is this JN1?
So it is a variant of COVID virus.
Can you name the exact mutant variant of which it is the
So it
variant?
is said to be a mutant of the Omicron virus.
What are variants of concern which were in use during COVID wave? Because since you work in COVID,
So Omicron was one of the variant of concern which was causing significant impact at the health system. Currently the JN1 is only a variant of interest and we are monitoring its levels and infections.
in 2024, India is trying to eliminate Kala Azar as well as leprosy. So which target is likely, as per your knowledge, likely to be achieved?
So we are performing very well on the front of as far as the leprosy is concerned. I think we are moving in the right direction for achieving both of these.
What is the vector of Kala Azar?
So it's the CC fly.
CC fly is for sleeping sickness.
So sand.
Sand.
Fly.
Sand. Okay, and what is your strength and weakness as an individual?
So I think my strengths are that I'm a determined girl and a hardworking girl, and I focus on the task at hand. And so with respect to the weaknesses, I think I need to work on my communication skills and.
Your communicating.
One last word about the future of India. 10 years from now, what would you like to see in India?
So I think as we enter the Amrit Kal, sir, so I think the poverty will be able to cater to major populations, to large number of populations, and in fact, sir, will be able to provide them food and have equity in the society.
Okay, not bad. Okay, thank you. We need to pause that. We can give us a feedback.
Yes.
Better.